Hey Tech for Docs, this is Gihan here. Today I'd like to start a conversation about the Doctor's Control Panel. First of all, let me start off by saying that I have no conflicts of interest. This is purely a review or my personal experience with this decision-making tool over the last 2.5 years. Now, it's an add-on software that you purchase separately, and it talks to your practice management software and extracts coded information about the patient that you're seeing. The software runs as a panel on the side of the screen, as you see here on the right-hand side. When you double-click it, it opens up some information about the patient. As you see, it has the name of the patient. Now, this is a test patient. It also tells you that your waiting room is currently empty, and also it's got some headings here: items, clinical information, medications, immunizations, measurements, targets and tests. They use a traffic light method. Whatever's in red is outstanding, and yellow is somewhere in between, and green means that's been done. So for instance here, the first panel will show you that there are a few things that are outstanding, and as you know, this is a test patient who has diabetes. So for instance, they will say that this patient needs a diabetes cycle of care completed because of a particular reason, and the criteria here is that this patient has diabetes. Another example is a GP management plan. Again, this patient has diabetes, and the software detected that we haven't done a diabetes care plan for these patients, whether it's a GP management plan or a team care arrangement. The DMMR, or the Domiciliary Medication Management Review, is also something that's commonly missed, and here it will tell you that this patient needs one done, or he's eligible to have one done, and also when the software is properly installed, it will tell you the criteria. Clinical information is quite useful as well. That's the second line there. Now, it tells you that this patient has a My Health record, or he doesn't have one. Also tells you that this patient doesn't have any allergies recorded. That's why it's red. The third one or fourth one there is social history, and it's green here, as you see. That's because we've updated the social history for this patient, and it tells you when it was last updated and why and how it's important as well. And the next panel, you see some information about immunizations. Here it's all red because this is a test patient, but essentially tells you why and how certain immunizations are required. It's interesting to see Prevnar here as well, and as you know, this was only recently updated guideline, only in July 2020, and because this patient's over 70 years old, this patient does need a Prevnar, as he hasn't had that before, and it's PBS covered as well. You can get more information through the Australian Immunisation Handbook by clicking on the link there as well. Now, clinical measurements are quite important here, and it's all red again because this is a test patient, but it tells you which measurements are important in an 89-year-old. Now, as you see blood pressure, BMI, diabetes assessment, particularly because this patient was a diabetic, medication review, whether this patient had a podiatry review, MMSC, medication, weight and height and waist measurement done. And most importantly, these targets are very useful. Now, as you see here, it tells you that this patient's cardiovascular risk is high, and that's calculated by looking at this patient's blood pressure, age, cholesterol levels, smoking status, diabetes status, and so on. And this particular patient is fairly straightforward. Essentially, it's an elderly patient with diabetes, so cardiovascular risk is going to be automatically high. And as you see over there, that's why the statin button is turned red there. So this particular patient's cardiovascular risk is high, therefore he or she should have been on a statin. And this is red here because this patient is currently not on a statin. The last line here is very useful, and I actually use it almost daily, and it gives you a clinically indicated or evidence-based guideline about what tests are required. And this is specific to this particular patient. For instance, because he's a diabetic, albumin creatinine ratio, vitamin B12 levels, and it tells you what the criteria is. That's because this patient's on metformin. Therefore, B12 levels are important to know, especially if the patient's got a poor diet. And the next section or next button is BMD. Now that's a commonly missed screening test, and this patient needs a BMD done, or bone mineral density done, because of this patient's age. Next one is eGFR, full blood count, and so on. And again, if you click on that button, it will tell you the reason or clinical indication as to why these tests should be done in the first place. So the reason why I like this software is it actually extracts coded information from the patient's file. And what you see is relevant and specific to the patient that you currently see. Traffic light system or traffic light colors to say what's done, what's overdue, and what's in between. And normally you will see another line that tells you some information about your billing as well, which is actually quite useful. It gives you a timeline of how your billings have been. A common fear is the fear of de-skilling ourselves by using these type of decision-making tools. Now, personally, for me, it's the contrary. I think I've learned more things by using this software. For example, I didn't know that people who are on metformin may have vitamin B12 deficiency because of metformin. Now, these kind of little things are picked up as I used this software. So for me personally, it's a learning tool as well. So overall, I'm very happy with this software.